Hi, everybody. This is an introductory screen recording for Nursing 621A for the spring semester. I'm sorry that I'm not going to be able to be there on the first day to speak to you live, but I've set up a couple of options here so that we will be able to communicate when the semester starts this coming week. And if there's any questions, please let me know and I can speak to you one-on-one, or we can use some of the question and answer blogs that I have in the Moodle. So right here is the actual Moodle screen for 621A. Listed in the welcome area is the dates that we're going to be meeting. We meet 6 times with the actual work that's going to be done on the 19th, basically on your own. It'll be nice. You might be able to do this as you can, get up, move around, because there is quite a bit of information that we do in each of these sessions. We start at 9 o'clock in the morning. We usually end by around 3:15. And then that way, for those who are taking 621B, we will start right after that so that we can make our day efficient. The 621A syllabus is listed right here. I have it up here, and I'm going to go over that with you. Also in here is the rubric for the PowerPoint presentation, which I'm going to explain in just a couple of minutes. So the syllabus is listed right here. It has all of my information, including my email and my cell phone. Typically, we will be able to talk back and forth on Moodle with some of the question and answer areas, but there are times where you might need to get a hold of me. It's always best to try and get a hold of me by email, but if you need to get a hold of me more urgently, you can call my cell phone. I just ask that you do that between normal business hours and not late in the evening or on the weekends or holidays. The course overview is listed right here. I'm not going to bore you with all that, but that basically explains the objectives for 621A, and this deals with management of chronic disease in the adult patient. So we have your clinical rotations. We urge you to be in a primary care setting so that you are able to see some of the chronic disease states that are typical of the adult population and be able to manage them effectively. The outline of the course is listed right here. It includes theory research discussing treatment options based on standards and guidelines. And I'm sure that you have heard in your prior classes that we practice evidence-based medicine. So things are not just are listed in your books because they are the things that have been tried and true and researched and are important. The class is evaluated based on the following. Because we only meet 6 to 7 times a semester, it's very important for you to attend the class. We meet for more than 6 hours. We go through a tremendous amount of information, and so it is very important that you attend these classes. If you miss more than 2 classes and do not notify me, it will result in a course failure. And if you have any kind of extenuating circumstances, please get a hold of me as soon as possible. I also hope that you're an active participant in the course, and so it would be good for you to be prepared with doing some of the readings and looking up ahead of time on some of the topics so that if you have any information, you're able to ask right then and there. There is a class presentation that is done in the course. It is a PowerPoint presentation that you will do one topic on. I have already split up the dates that you're going to be preparing or going to be presenting. And for those of you who are going to be presenting at our next class in February, I've already listed the topics that you will be responsible to present. Each student is going to present the topic, make sure that the references are listed in APA format, and make sure that you include the following information. Make sure that there is a general information about the topic, some presenting signs and symptoms, discuss the diagnostic workup if it's indicated, and discuss the treatment options. Most times you'll be able to find a lot of this information on the in some of the current book, which is the required text for this class. However, you can also look outside of that in a peer-reviewed journal, articles that you might find, anything that you feel would be pertinent. There's also discussion boards that you will be doing every other week. They were basically set up last semester as a way to try and just reinforce the learning of the topics that we were presenting, and the students really did find them very helpful. So we took all of the things that they really liked about them and put them in these discussion boards, and I will go over the discussion boards in just a little bit. The due dates for each of the discussion boards and the specific instructions for the discussion boards are going to be posted as well. There are test exams that we have every week that you are in class. They are worth 60% of the grade, and each test is not cumulative. It's based on the information that we've covered from the prior week. These, like I said before, they're non-cumulative. They are online, so please make sure that you bring your laptop computer with you. What we do typically is we have you come in to class, have you take the test, and then we start with that day's information. The text is the Current Medical Diagnosis and Treatment 2015. It's by Papadakis. It's actually one of the best textbooks that's out there for internal medicine and for adult medicine. I use it personally in my practice, and I find that it's very helpful. I've been a nurse practitioner for 14 years in internal medicine, and I also have been a nurse practitioner in the emergency room. So I have a bit of knowledge, and I think that throughout both of those experiences, I've used the current almost exclusively to get information that I needed. The other required text is the Washington Manual of Outpatient Internal Medicine. This is also a very good book. It's a little bit more of an abridged, smaller text, and sometimes you can get some very quick information, especially if you have a patient in the office and you want to find some information very quickly. You're able to actually use that text as well. And then if you're going to be a nurse practitioner, whether you're family or adult or acute care, it's very important that you get a good skin dermatology book. Now, the one that I have listed here is Habif. It's clinical dermatology. It's a suggested text. Out of all of the derm books, I've liked that one, but there's also a Fitzpatrick color atlas of dermatology that's also very good. I just think that it'd be a good idea for you to get a good dermatology book. I think it would be helpful. The mission and vision statements are listed right here. Take a look at them as you at your leisure. You can certainly read up on all of that. Just a little bit of a word about me. I am the co-director right now for the graduate program with Professor Greenwald. I am a nurse practitioner. Like I said before, I've been a nurse practitioner for the past 14 years in an internal medicine office in Schenectady, New York. I work with 4 other board-certified internists, and I love the patients that I take care of. I'm actually a graduate of SAGE. I went to school here and got my master's as a clinical nurse specialist. And then I also got postgraduate certificates as acute care nurse practitioner and as a family nurse practitioner. And hopefully this May I'll be graduating from George Washington University with my doctorate in nursing practice. So I do understand and realize that working and going to school takes up a tremendous amount of time and can be very stressful. So I urge you to look at the syllabus and look at the dates that we're going to be meeting and kind of find a way to make it all work. I understand it, but I also know that you have to be organized and stay on top of everything. So I'm hoping that you'll be able to do that effectively. And like I said, if you have questions or there's an issue, please let me know. Okay. The next thing that's on here is the PowerPoint presentation rubric. So I'm just going to pull that up. You can look at that again and have it for your reference. Typically, presentations should be sent to me before the day of class. If you don't feel like you're going to have it ready to go and you need to bring it that day, that's fine. It's just that if the presentation is ready to go when it's up, then students can usually access it very quickly. If they want to make notes, sometimes they print out the PowerPoint presentation. The introduction basically should include the epidemiology of the condition as well as any kind of interesting information that you think would be pertinent. The content is about 40%, which would include the conditions, the presenting signs and symptoms, the current diagnostic workup, the treatment options. The other thing I want to do is make sure that you are considering social determinants of health. New big buzzword here in healthcare, but it's really identifying the cultural barriers, the insurance barriers, the socioeconomic issues, and how to incorporate your plan of care, keeping those types of issues in mind. Also, try and see if you can find any information about cost considerations or financial implications of the diseases and the diagnostic criteria and management. We don't always want MRIs for patients who've got back pain, and the information out there about shared decision making and trying to empower patients to take better care of themselves includes the education to the patient that not every back pain needs an MRI, and there are certain ways that we can effectively manage patients without putting them through costly exams. The presentation style is 10%. That's your PowerPoint presentation. And then scholarly work. That basically tells me that you've taken some effort to look at what's out there in the literature. It tells me that you have researched and tried to include other references besides the current book, and that you have researched the topic sufficiently. Just a word about the references. They should be within 3 years, and everything on the reference part of the PowerPoint presentation should be in APA format. That's a total of 100 points. And again, if you have any questions, you can let me know. The first day I have listed presentations, PowerPoint presentations that I've done myself, so you can get an idea of what I'm looking for based on the PowerPoint presentations that you review for class. Okay. Going through the rest of this, like I said, we're going to have a bunch of PowerPoint presentations listed on the 19th. These are narrated PowerPoint presentations, but due to the size of the files, because they are narrated PowerPoint, we're going to have to access them through YouTube. So you'll have to be online in order to get them, and there'll be links that will get you right to the YouTube presentation. Like I said here, I've listed people's names under where they're going, who's going to be presenting on the 2nd of February. I will be presenting lectures on hypertension, hyperlipidemia, atrial fibrillation, COPD, and asthma, and then the students are responsible for these presentations as well. I have to back up just a little bit. Like we had talked about, there's going to be discussion boards throughout the weekly sessions as well. So if you click on this discussion board, what's going to be listed here is an activity that you will do while you're off for the 2 weeks in between classes. So this first discussion board, if you click on it, it has a situation which gives you a case scenario, and then the activity is for you to write a SOAP note based on this information. So I will tell you to use some creative licensure here and be as creative as you want to with the SOAP note. And once you have finished a SOAP note, you're to submit it online. And then once you're finished, take a look at 2 other students' SOAP notes and add or comment to their entry. So if you, for instance, if you're talking, if you make up a assessment and plan with this patient, and you decide that this patient has, condition X, and when you're if you're a student that's reviewing it, and you say, oh, that doesn't sound right, or I agree with your assessment, and the literature states that you should be offering X, Y, and Z, when you look at the literature, you should be able to cite your information about where you found that in APA format. So your response to somebody's SOAP note when you look at this is to either add to and complement the SOAP note, or talk about other ideas and issues, and those other ideas and issues should be something that has come out of some research that you have found. I will be looking on on the entries for the discussion board, just to kind of keep you guys on the right track. Like I said, this will open up on the 19th of January, and you'll have 2 weeks to complete it. And please do not respond to anybody's post to stating "nice job, I agree," because that's not what we're here to do. We're here to kind of effectively continue to grow in the um, in the information world and continue to get you thinking more like nurse practitioners in diagnostics, implementations of plans of care, medication rendering, etc. Okay. So going back, so that's discussion board 1. Like I said, you will have narrated some narration here, and I'll put that up front. And then the rest of these lectures will be built as the time goes on. If there's something in particular that you have any question on, I will put up a question and answer blog right here in this welcome section so that you will be able to ask. Chances are, if you have a question, somebody else has a question, and I can respond to it, and everybody can see it. So please let me know if you have any questions, and I look forward to seeing you on the 2nd. And please take your time going through the PowerPoint presentations for the 19th and enjoy it. This will be a good course. Typically, students that take this course say that it's the best course that they take so far because there's just a lot of information that you will feel is really applicable to you becoming a nurse practitioner. And I look forward to working with all of you this semester. Thank you.